And
Start whenever you want.
Start when you want.
Growing up with a bipolar or mentally ill parent isn't just challenging on the child's everyday life, but it's challenging on their future development as well. Being in an unstable living environment and having the parent in and out of their life all the time becomes very difficult. And some background information about bipolar disorder is there are two sides of it. There's mania and there's depression, and tons of families are affected by it. And it's more prevalent in women than in men, but the depression in women is more prevalent than mania in men. And there is more drug abuse with people that have bipolar disorder. They have a higher chance of it. In fact, there's a 56% chance of it in bipolar disorder, people with bipolar disorder, to abuse drugs or alcohol, according to the mental disorders section of dualdiagnosis.com. And children that have to grow up around it face hardships every day because they end up with behavioral problems, anxiety, and other issues, and they're forced to grow up faster than normal children because some are forced to take care of their siblings or take care of their parent, which is role reversal, which is called parentification. And this affects their childhood because they never get the chance to have a normal childhood. And some are teased, some are bullied because some other children don't understand that they have problems in their family and that their parent isn't just crazy, their parent has a mental disorder. And a lot of people don't realize that. And so whenever drugs and alcohol are mixed in, I have an example here of what Xanax does to the brain. Just an example of one drug. This is Xanax, and what it does is it slows down brain activity, as you can see here. It's a snail as a brain, and it's hard enough to maintain a relationship with someone that has bipolar disorder, but a person who is on drugs, especially a drug like Xanax, becomes more difficult to maintain a relationship with them, and then the child worries every day of their life if their parent's even going to wake up that day. And this is a chart that shows the mania and the depression, and then the good times and the bad times, and then growing up around bipolar disorder for children is some children face abuse and maltreatment. Some children are abused because their parents cannot control their mania when they have it, and that's a very common thing because when you have bipolar disorder, it's hard to really control yourself. And women tend to face more challenges of bipolar than men, especially if they're pregnant or just had a baby. They're more than likely going to be hospitalized for their condition, and the hormones that women have naturally cause it to be more severe. And mania and depression are two highs and lows, and so if they're on drugs, the children have to cope with the highs and lows of the mania and the depression, and then they also have to cope with the highs and lows of the drug abuse. And parents will tend to not be around, children have to fend for themselves, and then the children don't live a normal life, and family gatherings become practically impossible, and you can't ever have just normal daily routines. Always are disrupted or messed up in some way because the parent just cannot function normally. And just everyday life, day-to-day things that normal people do, like go grocery shopping, is just nearly impossible to accomplish without some struggle. And there are many misconceptions about bipolar disorder, and that's why people are so quick to judge. And even family members will look at the child and say, oh, you're going to be just like your mom, you're going to be just like your dad, whatever, because they don't understand it the way that the child has to understand it. And they don't have have to deal with it the way that the child has to deal with it. And so the child will end up thinking the same of their parents as everybody else is saying, because that's just what they've heard all their life, bad things. And so the problem with bipolar is that nobody really understands it unless they live around it, and then that's part of their day-to-day life. And so people judge and people say things and people are rude about it, and that affects the child because the child will grow up insecure and anxious and confused, especially if the parent isn't around or the environment isn't stable, or they're going to live with family member to family member because their parent keeps being hospitalized. And it just becomes more and more challenging as the child gets older, and then they're forced to take care of their siblings or take care of their parent as if they're the adult, and so they never really get a fair chance at having a childhood. And then in the end, it's just difficult. The child has a difficult life altogether. So I'll show you, this is the difference between a normal brain and a bipolar brain. As you can tell, there's a huge difference in what that looks like. And then the child can also end up being resentful toward their parent, which is never good, because you should always have a relationship with your parents, but it becomes difficult whenever they're not there or you're the one having to take care of them, and they take your childhood away from you. So all in all, the main thing about bipolar disorder is that it does affect tons of families, and women deal with it more than men, usually in most cases, and the children are very negatively and adversely affected by it, and if drug abuse or alcohol abuse is involved, it becomes even that more challenging. And then the misconceptions about it are even worse for the children, and it makes it even harder on them when people judge. So that's it.